Okay, let's start drug use in medical pregnancy, a medical emergency. The drug use commonly encounter medical emergency like shock. In shock, you can use adrenaline, noradrenaline, dopamine or dobutamine. In convulsion, there is a diazepam, phenytoin, midazolam. Electrolyte imbalance or acidosis, you can use potassium chloride and sodium bicarbonate. If there is hypocalcemia, you can use calcium gluconate. If it's bradycardia, you can use atropine. Anaphylactic shock, you can use hydrocortisone, adrenaline, chlorpheniramine or pheniramine. Okay. What are the drug used in shock? In drug used in shock, that is adrenaline, epinephrine. Pharmacology, it is a sympathomimetic catecholamine. Where you use during emergency, it is used in following condition: if the patient develop hypotension, bradycardia, anaphylaxis, asystole, ventricular fibrillation, pulseless electrical activity. In that condition, you can use adrenaline. Contraindication, there is no. It is a given life-saving emergency. Okay. Then doses. Suppose the patient develop bradycardia and hypotensive states, as IV infusion at an initial rate of 2 to 10 microgram per minute, and you gradually increase stepwise gradually until the desired heart rate is achieved. Okay, 2 to 10 microgram per minute. Anaphylaxis, if you saw any patient develop anaphylaxis after blood transfusion reaction or any food intake or food allergic reaction, then you can give 0.3 to 0.5 milligram of undiluted adrenaline 1:1000 administered intramuscularly or subcutaneously in anterolateral aspect of thigh. You can repeat this dose after 5 to 10 minutes as necessary. Okay, remember this anaphylactic dose, it is very important. Every situation you can use this anaphylactic doses like 0.3 to 0.5 milligram in 1:1000 dilution undiluted, 1:1000 dilute, 1:1000 administered intramuscularly or subcutaneously in anterolateral aspect of thigh. Repeated the dose every 5 to 10 minutes as necessary. If you saw the patient are asystole, ventricular fibrillation, pulseless electrical activity, it is used in 1:10,000 dilution in a dose of 1 milligram IV bolus dose. Okay. Remember these three indication. Mostly this anaphylaxis, you can remember 0.3 to 0.5 milligram 1:1000 undiluted. In asystole, ventricular fibrillation, pulseless electrical activity 1:10,000 1 milligram IV bolus dose. Okay. Then preparation. Adrenaline is available. Usually adrenaline is available in 1 ml ampule, 1 ml ampule with concentration of 1 milligram per ml. So dilute 1 mg in 250 ml of 5% dextrose solution. This will make this concentration of adrenaline 4 microgram per ml. This fluid is then infused initially at the rate of 1 microgram per minute and gradually increase to desired dose. One milligram in 1 ml, 1 milligram per ml. Usually the ampule is contain 1 milligram per ml. So in 1:1000 adrenaline concentration is 1 ampule of 1:1000 adrenaline in 1 ml. This is equal to 1 milligram in 1 ml. That is 1000 microgram per ml. If 1 ampule is diluted to 10 ml, there will be 0.41 mg per ml, that is 100 microgram per ml, that is 1:10,000 adrenaline concentration. To dilute to the 10 ml, 1 ampule has to dilute to the 10 ml. Noradrenaline you can use. The same thing is noradrenaline is used in hypertension to preserve cardiac and cerebral blood flow along with volume along with volume replacement during shock volume replacement treatment underlying cause the mainstay. The contraindication should not be used in hypovolemia without concurrent volume replacement. It is contraindicated in cases chronic mesenteric peripheral vasoconstriction unless life-saving procedure. The infusion fluid prepare NORAD. How will prepare the NORAD? By adding 2 mg of norepinephrine to 500 ml of 5% dextrose. Each milliliter of this solution contains 4 microgram of noradrenaline. Each milliliter of this solutions. Now the solution, each milliliter of the solution contains 4 microgram of noradrenaline. Initial dose is 2 to 3 ml, that is 8 to 12 microgram of the diluted drug per minute. The rate is adjusted to maintain 100 to 120 mmHg of distributed pressure. Average maintenance dose range from 0.5 to 1 ml, 2 microgram to 4 microgram per minute. This is category C drugs. Category the other treatment hypertension. It is low cardiac output, low proportion dopamine. To increase doses is to increase the renal blood flow, urine output 1 to 5 microgram per kg per minute IV infusion. To increase cardiac output, heart rate, cardiac contractility 5 to 15 microgram per kg per minute IV. Increase in blood pressure but with vasoconstriction may increase risk of tachyarrhythmia 20 to 50 microgram per kg per minute. Drug use for convulsion, diazepam, benzodiazepine group of belongs to benzodiazepine group of drugs. For acute control of seizure, you can give 5 to 10 mg IV slowly over 2 minutes. Pre-medication before anesthesia, 10 mg IM you can use these drugs. Okay, diazepam preparation is category C drugs. Phenytoins you can use for first line drugs in case of generalized tonic-clonic seizure. It also used in case of simple complex partial seizure and status epilepticus occasionally. In an alternative in eclampsia when magnesium sulfate is contraindicated. Midazolam, also short-acting benzodiazepine, active CNS depressant. This is facilitates the inhibitory GABAergic transmission. Doses intravenous 1 mg slowly over 2 minutes. Then response is assessed. Not more than 2.5 mg is given. Maintenance dose is usually 25% dose required to achieve adequate sedation. Drugs used for electrolyte imbalance like potassium chloride. It used in condition which cause hypokalemia like excessive vomiting, diarrhea with diuretic drugs. Diabetic ketoacidosis, adrenal gland disorder. It is given serum potassium level fall below less than 2.5 milliequivalent per liter. The dose is potassium chloride solution is prepared in concentration 20 to 40 milliequivalent in 500 ml of NS or 5% dextrose solution. It is transfused at rate not exceeding 10 milliequivalent per hour, and in 24 hours the dose should not exceed 200 milliequivalent. If serum potassium level is less than 2 milliequivalent with ECG changes, it can be infused at the rate of 40 milliequivalent per hour. With maximum, we can go for a 400 milliequivalent in 24 hours. So remember, usually we are using the potassium chloride injection during the ward. If the patient has hypokalemia, you use 20 to 40 milliequivalent. You can use 20 to 40 milliequivalent KCl in 500 ml of NS or 5% of dextrose solution. It should be transfused. The rate should be 10 milliequivalent per hour. In 24 hours, the maximum is 200 milliequivalent. It should not be. And if there is less than 2 milliequivalent potassium level, it can infuse at rate of 40 milliequivalent per hour compared to 10 milliequivalent per hour. Then 10 to 40 milliequivalent, the dose maximum dose is 400 milligram equivalent for 24 hours. Sodium bicarbonate, it is used intravenous bolus or infusion for correction of the acid-base imbalance. The indication of its use, it is used in metabolic acidosis as in circulatory insufficiency due to shock or severe dehydration, severe renal disease, uncontrolled diabetes. The contraindication is metabolic and respiratory alkalosis and hypocalcemia. So how to calculate the dose requirement of sodium bicarbonate can be calculated by the following formula. You can use this formula, that is 0.2 into weight of the patient with the base deficit. Suppose the patient or you can use this formula 0.5 into weight in kg into 24 serum bicarbonate milliequivalent per liter. The solution for IV infusion is prepared by dissolving required amount of sodium bicarbonate in 500 liter of normal saline. Initially, and the infusion rate is 2.225 milliequivalent per kg body weight. It is transfused over a period of 4 to 8 hours. This will produce a measurable improvement in the abnormal acid-base status of the blood. Then further dose is calculated based on the patient's response and base deficit on ABC. Okay. Drug used in hypocalcemia. The calcium gluconate is the calcium is an important body constituent. The indication is hypocalcemia, hypocalcemia related to hypoparathyroidism, maximal toxicity. The doses depend on the requirement of the individual patient. Without seizure or tetany, 0.5 mg per kg per hour IV infusion with the maximum dose is 3 to 4 gram IV over 4 hours. In hypocalcemic tetany, if she has hypocalcemic tetany, then 2 gram calcium gluconate is given IV over 5 to 10 minutes followed by continuous IV infusion of at 0.5 mg per kg hour. 10 ml. Drug used in bradycardia, like atropine you can use. The like dose is sinus bradycardia, hypertension 0.5 to 1 mg IV every 5 minutes, not more than 3 mg. Adverse drugs and technologies. Drug used anaphylactic or hydrocortisone, sodium succinate. The doses in shock and status estimated 1 to 2 mg per kg, like 50 to 200 mg IV 24 hours, followed by maintenance dose of slow IV 6 hourly 100 mg, 0.5 to 1 mg per kg slow IV every 6 hourly. Acute adrenal insufficiency 100 mg IV bolus followed by 100 mg 80 hourly IV slowly over 30 seconds. Chlorpheniramine maleate, pheniramine maleate. In the above condition, chlorpheniramine used in dose of 10 to 20 mg IV or IM or as subcutaneous injection. Maximum dose is 40 mg, 10 to 20 mg IV or IM. Injection of pheniramine 22.75 mg IV or IM. Okay. These are the drugs used in emergency.